Welcome to the VOALA Adult ASI Questionnaire Part 3, Legal Status, Family History, Family and Social Relationships, and Psychiatric Status webinar. The Legal Status section of the ASI helps you to gather some basic information about your client's legal history. It addresses information about probation, parole, charges, convictions, incarcerations, detainments, and illegal activities. For question L3 through L16, it asks, how many times in your life have you been arrested and charged with the following? Be sure to include total number of counts, not just convictions. Do not include juvenile crimes unless they were charged as an adult. For question L21, it asks, how many months were you incarcerated in your life? Enter the months spent in jail, prison, or detention center in the client's life since the age of 18. Record months incarcerated before the age of 18 if the client was detained as an adult while still a juvenile. If the months equal 100 months or more, enter 99 and note the details in the comments section. Remember to count as 1 month for any period of incarceration that was 2 weeks or longer. For question L26, it states, how many days in the past 30 were you detained or incarcerated? Be sure to include being arrested and released on the same day. For question L27, it asks, how many days in the past 30 have you engaged in illegal activities for profit? Be sure to exclude simple drug possession. However, include drug dealing, prostitution, and selling stolen goods. The next section is the family history section. The section of the ASI examines the possibility of significant drinking, drug use, or psychiatric problems within the client's family. For all questions in the family history section, please indicate if there was any significant drinking, drug use, or psychological problems associated with that family member. If the client is uncertain or does not know, select Not Answered. And if that person was not a relative, select Not Applicable. For example, the client only had one brother. For brother number 2 in question H11, sister number 1 in question H12, and sister number 2 in question H52, select Not Applicable for all 3 questions for each sibling. In addition, in cases where there's more than one person for a category, for example your aunt or grandfather, record the occurrence of problems for any in that group. Don't forget to make comments if any family member is a yes for any question. The next section is Family and Social Relationships. This section of the ASI examines the nature of the client's personal relationships, marital, and living status. Overall, it determines if the client has relationship problems with family, friends, or others. For questions F27 through F29, click on the Add button and select from the pick list which person had abused the client emotionally, physically, or sexually in the past 30 days or lifetime. These questions assess what may be important aspects of the early home life for these clients, and to assess dangers in the recent and possibly future environment. It will be important to address these questions in a supportive manner, stressing the confidentiality of the information and the opportunities for the client to raise this in subsequent treatment sessions with an appropriate provider. Question F30 and F31 refers to serious conflicts. Conflicts require personal or at least telephone contact. Remember to stress that you mean real serious conflicts. For example, serious arguments and verbal abuse are considered serious conflicts and not simply routine differences of opinion. These conflicts should be of such a magnitude that they jeopardize the client's relationship with the person involved. The final section is psychiatric status. When administering this section, it is important to remember that the ASI should be considered a screening tool rather than a diagnostic tool. Therefore, a client need not meet diagnostic criteria for a symptom to have experienced the symptom. Further, the ASI will not provide definitive information on whether drug problems preceded psychiatric problems or vice versa. All symptoms other than those associated with drug effects should be counted in this section. For example, depression and sluggishness related to detoxification should not be counted, whereas depression and guilt associated with violating a friend's trust or losing a job should be counted. For question P1 and P2, it asks, how many times have you been treated for any psychological or emotional problems in a hospital or inpatient setting or as an outpatient or private patient? This includes any type of treatment for any type of psychiatric problem. This does not include substance abuse, employment, or family counseling. The unit of measure is a treatment episode, which is usually a series of fairly continuous visits or treatment days, not the specific number of visits or days in treatment. For example, if the client has seen a psychiatrist every week for the past 2 years, this will be counted as one treatment episode. For question P4 and P5, experienced serious depression is suggested by sadness, hopelessness, significant loss of interest, listlessness, difficulty with daily function, guilt, or crying drags, while experienced serious anxiety or tension is suggested by feeling uptight, unable to feel relaxed, or unreasonably worried. Question P8 through P10 are of sufficient importance that even their brief existence warrants that they be recorded. Further, the seriousness of item P8 through P10 warrants inclusion even if they were caused by or associated with drugs or alcohol. Reports of recent suicide attempts or thoughts should be brought to the attention of your supervisor as soon as possible. When you are done with the ASI assessment, be sure to put an end time. As a reminder, don't forget to probe, cross-check, and make plenty of comments. In addition, save often and make your best effort to have the encouraged questions answered.